we have made some significant biomechanical changes in you. You start to get your curve back in your cervical spine, your head's up over your shoulders where it's supposed to be, your pelvis is more centered up now. That's excellent.
I feel it too.
Yep. Let's come over this way and do this one first.
Dr. Johnson, is there a reason why you do a certain thing first, or is this just based on?
I adjust on that table on a brand new patient first, so I can get a feel for their muscular and ligamentous tonus. That way, I get a feel for how their spine's moving or not moving. And then I bring them over here on the decompression table because I already have that feel for the spinal mobility registered in my sensory perception in my hands. The art of chiropractic is really all about sensory input and output through the chiropractor's hands. Chiropractic truly means done by hand. So, we really develop the senses in our hands, and that's what I use. And a lot of times you'll see when I'm adjusting a patient's necks, I'll close my eyes even and adjust him because I'm feeling it more. You'll see I'll do that with Moni when I adjust his neck. It's actually easier for me to close my eyes and adjust people than it is to leave them open. There we go. Now I leave my eyes open on this one, but I'm still feeling this one just like all the other adjustments. I bring it to tension. I'm not just pulling it from slack. Bring it to tension and then pull it through the paraphysiological space. That's the anatomical ligament integrity of the joint. So I'm actually moving the joint through its fullest range of motion to the anatomical integrity of the ligament, so I'm not spraining the joints. Because a sprain is a ligament injury. That's when you go beyond the normal ligamentous range of motion. And see, I just feel that, just like that. And that felt great, didn't it?
Amazing.
And you're relaxing really well now too. That helps tremendously. When people learn to relax and just breathe, that's when they get the best adjustments. Okay, let's come over here on your tummy next. Chiropractic is a science, art, and philosophy. The science of it is that we know that the spine, the 24 freely movable vertebrae, from the cervical spine all the way down to the sacrum of the pelvis and lumbar spine, they encase and enhouse the spinal cord. So they are the direct protection for the brain's nerve signals down through the spinal cord all the way down the spine itself. And then between each and every one of those 24 freely movable vertebrae in the spine, nerves exit off of them and come out to supply every organ, muscle, tissue, and cell in your body. So what we do as chiropractors is we detect and then correct what we call vertebral subluxations. A vertebral subluxation is a aberrant alignment of one vertebral level with the adjacent vertebral levels above and below that, or in the pelvis case, the adjacent bones to the side, which is sacroiliac joint, sacrum ilium, sacroiliac joint. So the whole purpose of correcting the biomechanics of the spine is so that the spinal cord and the spinal nerves can come out and exit between the vertebrae without being compressed or interfered with. And that's what helps restore the body to a higher level of function. And the body then heals itself. I mean, you know that being in natural wellness, right? The body heals itself if allowed to do so without interference.
Yes, sir.
And that's what we're doing. We're just detecting and then correcting and removing that interference. A lot of people don't realize that chiropractic is a health healthy lifestyle choice, just like eating right is a healthy lifestyle choice, just like working out regularly is a healthy lifestyle choice. Chiropractic is a healthy lifestyle choice that should be in everyone with the spine. I have an old saying, only the spineless don't get adjusted. And I've said that for 37 years now, which is the time frame I've been practicing. The only people who don't get adjusted are the spineless.
So who adjusts your spine, Dr. Johnson?
I've got a couple of different people that I get adjusted from. Dr. Dale White's one of them up in Fort Worth. He comes down and visits with me frequently. I have another chiropractor here in Houston that I've taught how to do this technique that I use on myself, and he comes in and adjusts me. And I'm teaching my intern a bunch of different of my techniques too. Now he's not allowed to adjust anybody because he's not a Texas licensed chiropractor, but I can still teach him how to do stuff and work on me. Let's go on your back, because he's not adjusting the public.
Yeah.
You have to be a Texas licensed chiropractor to adjust the public. Here in Texas, anyway. See, I can't go to Louisiana or Florida or over to the UK like so many people want me to do. People want me to do a world tour, but what they don't realize is you have to have a license in every state that you go to, or every country that you go to practice. And they don't just give those away. I mean, when I graduated from Palmer College of Chiropractic, I passed the National Board Part 1, Part 2, and physiotherapy portion of the National Board. Then I had to come back down here to Texas and pass the Texas State Board of Examiners written and practical examination. You know what my question was for my Texas license? This will blow most people away. I analyzed lab, read x-rays, was given the physical examination findings. Guess what the person's diagnosis was that I had to pass for my Texas board? Prostate cancer. So that was my board question that I had to practice or pass on the practical part of my Texas Chiropractic Board. Most citizens, regular people out there don't know that we are trained and educated very well in the diagnosis, treatment, and rehabilitation of most all spinal related conditions or spinal related disorders, scoliosis, subluxations, birth defects, proper biomechanics in the spine from the cervical spine all the way down to the pelvis. Okay, let's stand you up over here now, Moni.
Looking great, Doc.
Yep, you're looking great too. Let's have another look here. Very good. There you go. Man, take a look at that in the mirror right now, Moni.